Subjective data regarding the female genitalia includes menstrual cycle history, sexual history, pregnancy history, menopause, vaginal health, pelvic pain, and urinary issues. Regarding the menstrual cycle, you need to know, is the patient's cycle regular or irregular? How long do they typically last? Do they experience pain or cramping, heavy or prolonged bleeding, or a lack of bleeding? Regarding sexual history, is the patient currently sexually active? Do they use contraception? Do they have pain with intercourse? And have they ever experienced a sexually transmitted disease? For their pregnancy history, you need to know the number of pregnancies that they've had, the number of births they've experienced, any miscarriages or abortions, when their last menstrual cycle took place, and are they currently trying to get pregnant. Next is menopause, and you need to ask, have they experienced menopause? If so, what are their symptoms, such as hot flashes or night sweats? Vaginal health consists of unusual vaginal discharge, odorous discharge, itching, burning, or pain in the vaginal area, lumps or bumps in the vaginal area, bleeding between period or after intercourse. You should ask the patient if they are experiencing any pelvic pain, and if so, can they describe it to you? Lastly, you should ask if they experience frequency, urgency, pain with urination, blood in the urine, or urinary incontinence. Pelvic examinations should be performed on patients 21 years of age or older unless otherwise indicated by medical history, such as menstrual disorders, vaginal discharge, or pelvic pain. Male examiners should be accompanied by a female chaperone, and female examiners should also be assisted if the patient is physically or emotionally disturbed or if help is needed with the examination. External assessment of the genitalia takes place with the patient draped for privacy in the lithotomy position using the stirrups. You should inspect the mons pubis, labia majora, and perineum for swelling, redness, lesions, or masses. You should then separate the labia and assess the labia minora for redness, inflammation, lesions, and swelling. You should examine the Bartholin glands and note if swelling is present. You should also note if the clitoris is enlarged, which may suggest an endocrine disorder. You should inspect the urethral meatus for redness, urethral caruncle, prolapse, and tenderness. Lastly, the vaginal opening, inspecting for inflammation, ulceration, discharge, swelling, or nodules. Internal examination also takes place in the lithotomy position. Gently separate the labia majora and insert the appropriate size speculum into the vaginal opening. Once inserted, adjust the angle to the horizontal position and carefully open. Once opened, rotate until the cervix is visualized. Through the speculum, you should inspect the cervix by assessing the color, position, and surface characteristics. You should note if there's any ulcerations, nodules, masses, bleeding, or discharge. If indicated, perform a pap smear and other appropriate cultures. This is performed by obtaining one specimen from the endocervix and another from the ectocervix, or using a combination specimen using the cervical broom. A culture of the cervix for chlamydia should be performed for sexually active women less than 26 years of age or women with increased risks. You should then assess vaginal mucosa for inflammation, discharge, ulcers, and masses while slowly withdrawing the speculum. You should then assess for uterine prolapse and vaginal wall defects by having the woman bear down while visualizing the vagina with a single blade speculum. Lastly, be sure to close the speculum as it exits the introitus to avoid causing discomfort. The palpation portion is a bimanual examination. This is performed by inserting the index and middle fingers of a lubricated gloved hand into the vagina. Be sure to exert pressure posteriorly to decrease discomfort. You should assess for nodules or tenderness of the vaginal wall. Palpate the cervix, noting position, shape, consistency, regularity, mobility, and tenderness. You should then palpate the uterus by placing the other hand on top of the abdomen, midway between the umbilicus and the symphysis pubis, and press in and down. You're trying to grasp the uterus between your hands. You should then note the size, shape, consistency, and mobility, and assess for tenderness or masses. You should palpate each ovary by placing the abdominal hand on either right or left side while simultaneously positioning the pelvic hand in the right or left lateral fornix. You should assess for size, shape, consistency, mobility, and tenderness, and note any masses. You should assess the pelvic floor muscles for strength and tenderness by having the patient squeeze around your fingers for as long and hard as she can. You should note the strength, tenderness during contraction, and appropriate relaxation after contraction, and endurance for all 4 quadrants of the vagina. Lastly, you should have the patient perform the Valsalva maneuver and assess for urinary leakage. Indicated, a rectovaginal exam can be performed with a new set of gloves. Introduce your index finger into the vagina and middle finger into the rectum while having the patient strain down to relax the anal sphincter. You should then apply pressure against the anterior and lateral walls while applying downward pressure from the abdominal hand, and note any masses in the rectal vault.